Dear gentlemen, perhaps recently you've noticed yourself waking up more frequently at night to urinate, or at times feeling a vague discomfort in the lower abdomen. These minor changes are often overlooked until they begin to affect your sleep, daily routines, and even your intimate life. Many men over 60 tend to think it's probably just a sign of aging. But in reality, some seemingly normal symptoms may be early warnings of a very common health issue: prostate enlargement. As a doctor specializing in men's health after 60, Dr. Marie, have met countless patients who came for consultation at a late stage simply because they ignored the early warning signs. That's why in today's video I'll walk you through 7 silent yet critical signs that you should recognize early to take better control of your prostate health. Especially the first sign I'm about to share. Many men experience it, but few realize that it's related to the prostate. Don't miss it. Before we dive into the main content, I'd like to ask you something. Where are you watching this video from? It would be wonderful to know who I'm accompanying on today's journey. Please leave a comment down below. And if this is your first time visiting the channel, don't hesitate to hit the subscribe button and turn on the notification bell so you won't miss valuable insights about men's health after the age of 60. Now let's move on to the first sign, a symptom many think is harmless, but in reality, it carries a much deeper meaning. Sign 1. Frequent nighttime urination. A seemingly small issue that shouldn't be ignored. Many men over 60 often believe that waking up once or twice per night to urinate is normal and not a cause for concern. However, if you're getting up 3 to 4 times or more each night, this could be a sign that your prostate is enlarging and pressing against the bladder. The prostate in men tends to grow with age. When it enlarges, it can compress the urethra, making it harder for urine to pass completely. As a result, residual urine remains, and the bladder needs to contract more frequently throughout the night, causing disrupted sleep, fatigue, and a noticeable decline in quality of life. Some of the older patients I've consulted with shared that, at first, they only woke up once per night, but it gradually increased to 3 or 4 times. Weeks of shallow sleep left them with memory problems, daytime fatigue, and a loss of interest in personal activities. If you're going through something similar, treat it as an early warning signal from your body, indicating that your prostate may be under stress and needs proper attention. Coming up next, we'll talk about a symptom often mistaken for a natural part of aging, but in fact, it reflects a much more serious disruption in your urinary system, one that's even more alarming than nighttime urination. If you're still watching at this point in the video, I truly appreciate it. It shows that you're taking your health seriously. Please leave a 1 in the comments below, so I'll know you're still with me on this journey. Sign 2. Weak urine flow. Need to strain. A discrete symptom with serious warnings. Many older men only start to notice their urine stream getting weaker after several months or even years, but often dismiss it as a normal part of aging. However, if you regularly need to lightly strain to begin urinating, or feel that your stream is no longer strong and continuous as before, there's a high chance your prostate is pressing on your urethra. An enlarged prostate can narrow the urinary passage, forcing the bladder to generate more pressure to expel urine. This doesn't just make urination feel difficult, it can lead to intermittent flow or the sensation of incomplete emptying. Over time, if this isn't improved, the bladder may weaken, resulting in urine retention, lower urinary tract infections, and a reduced quality of daily life. I've met many patients who said that even after using the restroom, they still felt like something was left behind. This sensation leaves them feeling uncomfortable, irritated, and it significantly affects their work, sleep, and even their sex life. If you're experiencing a similar situation, Don't underestimate it. It could be an early sign that your urinary system is under strain, and the underlying cause might be your prostate. Unrelated to urine stream pressure, the next sign is expressed through a fleeting sensation, and that's exactly why it's often overlooked. Sign 3. Mild burning or stinging sensation when urinating. A fleeting symptom that shouldn't be ignored. This is one of the most easily dismissed symptoms because it's often temporary and vague. A slight burning or mild stinging feeling when urinating is usually blamed on not drinking enough water, cold weather, or just general fatigue. But in reality, this could be an early sign of inflammation caused by prostate enlargement. As the prostate grows larger, it may cause friction or pressure on the urethra, especially during urination. This can lightly irritate the lining of the urethra, leading to a tingling, sharp, or burning sensation when you go to the bathroom. While not serious at first, if left unaddressed, it can increase the risk of widespread inflammation and potentially affect the bladder. Some gentlemen think that simply drinking more water or getting rest for a few days will resolve it. But in reality, once the prostate begins affecting the urinary system, this condition will recur more frequently if not properly managed. Don't dismiss these subtle signs. They may be the silent signals your body is sending you, and recognizing them early could help you prevent more serious complications down the road. Let's set aside the sensations related to urination for now, because the next sign is completely different. It directly affects your sexual health and confidence as a man. If you're still watching the video at this point, I truly thank you for your patience and your commitment to your own health. Please leave a number 3 in the comments below so I know I'm not alone in this journey. Sign 4. Gradual loss of libido and declining performance. When the prostate begins to affect male sexuality, many men after age 60 start to notice a drop in their enthusiasm for intimacy, even though they previously maintained a stable sex life. What's surprising is that this change doesn't stem from psychological stress or family issues. It may be the result of the silent impact of an enlarged prostate. The prostate is not only involved in urination, but it also plays a key role in reproduction, especially in producing seminal fluid and supporting ejaculation. When this gland becomes swollen or mildly inflamed, it can reduce blood flow to the genitals, which in turn affects arousal, pleasure, and sexual performance. Many men describe feeling low on energy, having shorter intimacy duration, and finding it difficult to reach satisfaction. But instead of suspecting the prostate, they often blame aging, unaware that testosterone levels, blood circulation, and even nerve function may all be affected simultaneously by an enlarging prostate. So if you feel like your sex life is declining, don't automatically assume it's just part of aging. It could be a health warning your prostate is trying to send you, and the earlier you address it, the better. Now, let's move on to a sign that can't be measured visually. It comes from a dull, vague sensation in the body that's hard to describe. Sign 5. Mild pain in the lower abdomen or groin. A dull discomfort often overlooked. Many men over 60 report a dull ache, heaviness, or mild pressure in the lower abdomen or groin area, especially after sitting for long periods, doing strenuous activity, or after urinating. But since the discomfort isn't sharp or specific, they often assume it's bloating, indigestion, or muscle soreness from physical work. However, in many cases, this is actually an early sign that the prostate is enlarging, pressing on the pelvic area and surrounding nerves. When the region between the bladder and rectum is affected, it creates a persistent discomfort, even though the pain isn't easy to pinpoint. Some gentlemen describe it as feeling like something is weighing down their lower abdomen, especially at the end of the day. Though not intense, this constant pressure affects their mood, makes them irritable, and lowers productivity in daily life. If you've experienced such discomfort without a clear cause, it's a good idea to consider your prostate. especially if you're also having urinary symptoms or noticing a decline in sexual health. Now, pay close attention to the changes in your urinary habits, because the next sign might be your body's way of saying it's starting to get overwhelmed. Sign 6, weak stream, interrupted flow, or having to strain. The silent pressure from the prostate. Many gentlemen over 60 start to notice clear changes when urinating. The stream is no longer strong, sometimes it gets interrupted midway, or they have to build momentum by straining slightly just to get started. Although it doesn't cause pain, this is one of the early signs of prostate enlargement. As the prostate grows, it compresses the urethra, the tube that carries urine from the bladder out of the body. This blockage weakens the flow, forcing the bladder to work harder, resulting in a sensation of difficulty urinating, interrupted flow, or longer time spent in the bathroom. If this continues over time, the bladder may lose its natural ability to contract efficiently. That leads to a feeling of incomplete urination, frequent urges, and constantly sensing that some urine is still left inside. At first, you may find it only slightly inconvenient, but in the long run, this is the starting point of a chain reaction of urinary issues, which can affect your overall health if not monitored and addressed early. And finally, we cannot ignore a sign that's often dismissed as a minor accident. But in reality, it's a serious alarm that your urinary system is losing control. Sign 7. Leaking urine or loss of control. When your body can no longer keep up. Some men in middle age begin to experience accidental leakage. Urine escapes when coughing, sneezing, bending down, or doing strenuous movement. Though the amount may be small, the repeated incidents leave them embarrassed, lacking confidence, and often resorting to wearing pads daily for prevention. This condition isn't just related to the bladder alone. It can be an indirect result of prolonged prostate enlargement. As the prostate swells, it continuously irritates the bladder, eventually making it tired and reducing its ability to control naturally, much like a valve that's overused and can no longer close tightly. Over time, the urinary sphincter weakens, and reflexes slow down. As a result, you no longer clearly feel the urge to urinate or fail to react in time, leading to involuntary leakage. Many men, out of shame, choose to endure it silently, avoiding checkups or talking to their loved ones. And it's this silence that allows the problem to worsen. If you've ever gone through something like this, treat it as a serious warning from your excretory system that it's time for a comprehensive prostate health check. And now we enter the most important part of this video. A warning about the dangerous consequences that may occur if the signs above continue to be ignored. At the same time, I'll also introduce to you a few simple natural ways to help manage this condition early on. Part 2. Ignoring early signs. The consequences you may regret. Many men after 60 still feel healthy and live normally until their bodies start to speak up through uncomfortable symptoms. Sleepless nights from waking up multiple times to urinate, constant fatigue, a drop in sexual desire and confidence in intimacy. Usually, it's only when these issues seriously affect their lives that they see a doctor. And unfortunately, by then, the prostate enlargement has become much more complicated. When not addressed in time, an enlarged prostate can cause urine to remain in the bladder for long periods. A perfect environment for bacteria to grow, leading to infections, burning during urination, high fever, and extreme fatigue. In more severe cases, patients may face bladder stones, weakened bladder function, or even kidney damage, an organ highly sensitive to prolonged urine retention. Another often overlooked impact is the gradual decline in male hormones, leading to a decrease in sexual performance and a loss of confidence. Many men start to withdraw from life, become less sociable, less cheerful, and distant even from loved ones. The good news is, if detected early and addressed correctly, you can absolutely manage this condition naturally and safely, without long-term medication or surgical intervention. Next, I'll share with you some simple yet effective supportive solutions that many middle-aged and older men have applied to significantly improve their prostate health. Part 3. Natural ways to stabilize the prostate and improve quality of life. If you're starting to notice the warning signs I've mentioned, the first thing you need to know is you're not alone. And second, your condition can be improved with very accessible and easy-to-apply changes if you start today. Medical studies have shown that certain nutrients such as lycopene from red tomatoes, zinc, and beta-sitosterol in seeds and nuts can help reduce prostate size, ease pelvic discomfort, and support improved urine flow. When combined with a diet rich in fiber, green vegetables, low-sugar fruits, and fatty fish, you can also balance male hormones, a key factor in maintaining performance in midlife. Not only that, maintaining a habit of light daily physical activity, such as walking, deep breathing, or yoga, can help improve blood circulation in the lower abdomen. Avoiding long periods of sitting and reducing alcohol and caffeine consumption are also small but effective steps to help your prostate breathe easier. Many of my patients shared that after just a few weeks of adopting a healthier lifestyle, they noticed clear improvements. Nighttime urination reduced, sleep quality improved, and their mood became more positive. Of course, every person has a different condition. So what's important is to listen to your body and choose the solution that suits you best. The key is to start with small but correct steps and keep them consistent. My dear friend, aging is something none of us can avoid. But staying healthy, maintaining your performance, and being proactive in life, that's a choice that lies in your hands. Prostate enlargement is not a sentence. It's just a reminder that your body needs more attention. And if you're persistent, starting with simple changes in lifestyle, diet, and daily habits, you absolutely can reclaim your performance, health, and confidence. If you found this video helpful, don't hesitate to hit subscribe and turn on the notification bell so you can continue following Dr. Marie for upcoming content on men's health after 60. Thank you for staying with me until the very end. I wish you strength, proactive living, and confidence in yourself every single day.